Welcome, fearfully and wonderfully made humans, to the Holistic Counselor podcast. It's me, Diana from Through the Valley Therapy. And today we're diving into a topic that's foundational to both mental and physical well being, the nervous system. I first discovered today's guest through an Instagram reel she posted on April 12th of this year, where she shared some truly thought provoking insights on the nervous system. Her words instantly grabbed my attention. Then, as God would have it, I realized we were both members of the same holistic business network. Fast forward to a couple of weekends ago, and we had the chance to briefly meet in person when we were both speakers at the relief retreat organized by the network. And now here we are to dig deep into the connection between the nervous system and mental health with this incredible guest. Dr. Lauren DeCicco is a doctor of physical therapy with over 15 years of experience, primarily in outpatient orthopedics and sports medicine. After years in the corporate clinical world, she launched her own practice to offer the kind of holistic care she believes in, focusing on full body healing by integrating the nervous system, lymphatic system, and movement analysis. Her mission is to help people achieve a regulated, resilient nervous system, rewiring the mind body connection and empowering clients to take control of their healing journey. Dr. DeCicco, welcome to the podcast.
Thank you. I'm so happy to be here. That was a great introduction. I really appreciate that.
Yeah. So listen, you left the corporate world because this is where I'm like really intrigued. You left the corporate world and started your own practice, which is something I resonate with, right? So,
Mhm.
what was the driving force behind this decision, and how has it changed your approach to treating clients holistically?
Well, so for me, I always felt that something was missing. Um, we were always treating lots of people. Our schedules are super full, but I felt really empty and I felt like my clients were being left with something on the table there. Like we were getting them better, but we weren't really optimizing what we could do for them. And I would, change jobs, go to different offices, things like that, but it was kind of always the same. And the mindset behind it was really more about treating the insurance
Mm,
rather than treating the person.
mhm.
And I mean, the conversations that I would have behind closed doors with management and the business side of it was just such a turnoff for me. And I felt like I was being a part of the problem as
Wow.
far as not getting people healthy and well again, but more so encouraging people to stay unwell and in the system because we knew we could utilize their insurance ultimately.
Right.
So you would see the people that were like more like cash based and things like that, that were really more taking control and responsibility over their health because they were more, because it was coming straight directly from them to the person providing the service.
Mhm.
They were more committed, they were more compliant, and they were getting better.
Wow.
And they were
Mhm.
being accountable for their own healing. So
Yeah.
I just knew being in the industry of being corporate and taking insurance and just like running this mill of getting people in, getting people out, and keeping them in the system wasn't the right thing to do.
Mhm.
And it also did not allow me to practice the way that I knew I should be practicing to like my fullest potential.
Okay.
And part of that was being able to connect with people. And when you practice in those clinics, like you just don't have the time
No.
and you don't have the mental capacity to
Right.
even take on that load. So that building connection was very, very important to me. So I knew I had to shift and be out of that particular setting. It wasn't about finding a new job at a new company because they're really all kind of practicing the same way
Mhm.
when you're in that field, in that like outpatient corporate field.
Yeah.
So I decided just to take the leap. I think COVID was a big proponent of,
Yeah.
I think a lot of people had really aha awakening moments during COVID
Yes.
in my personal life, in my professional life. And that really catapulted me to just take the leap and get out of that corporate world. And what I've seen being in my own practice since then, and Yeah, I don't take insurance, but I do that so I can work one-on-one individually with
Exactly.
everybody.
Hmm.
But I have seen such a tremendous effect on the outcomes by
Right.
practicing that way. Like I said, people show up, they are ready to commit financially, but also mentally, physically, like they're there to get better, and they've been through the system already, so they've been kind of like
Right.
fed up with
Yeah.
their symptoms, not getting answers,
Right.
things like that. So I've really found that it's been a lot more effective to practice that way. And I just feel like not participating in that insurance industry is going to be part of what helps to eventually remodel that. The more the practitioners kind of step away from not participating in that, the more that the
Right.
insurance industry is going to have to take a look at themselves and kind of remodel or restructure how this medical model is working.
Oh, yeah. Oh, no. And I see it in the mental health field. I mean, this is why I'm a
Yeah.
holistic therapist because, when I was doing community mental health, you can imagine it is like, all right, we have to chase the insurance and we had to diagnose. Like right now, it's like, I don't know if that law is pertained to you as a private practice practitioner, where I have to do a good faith estimate
Mhm.
to every new client. Do you guys have to do that too?
I think anyone that's really practicing out of pocket. So
Yeah.
yeah, I'll typically give people an estimate of like, okay, these are what my services
Right.
cost, and this is how what a typical protocol is going to look like this many
Yes.
times per week, so you can kind of estimate
Hmm.
what the cost is going to look like to you,
Yeah, but,
right?
but the thing is, I have to diagnose them the minute I get a phone call. Isn't that bizarre? Isn't that, to me, it's the most frustrating thing. I have to put a diagnosis on the good faith estimate, and I'm like, I just met them for 2 minutes, but that's the law,
Right. And that's so unfair to the person
right?
because, and a lot of people aren't, and that's another issue with like the medical model is everyone's a diagnosis.
Hmm.
And that just adds to the element of like not being well, of
Yeah,
this mentality of like, oh, well, I am, or I have, or
right.
my, I have a disc herniation. Now all of a sudden we're like our disc herniation, right? And
Yes, and
like that's our
and we feel
ticket.
stuck.
Yep. So I don't even like love to give a diagnosis. I mean,
Mm.
if you're doing insurance, I have to give a diagnosis.
Right.
I mean, for the PT world, which is nice, is we really base off of their presentation of what their functional limitations are. And
Mm.
that's how we determine how we're going to treat, because it's not really about their diagnosis. It's more about optimizing their
Right.
overall function and
Right.
presentation.
Yeah, it's getting your patient client, I like to call them clients, not patients, right? To understand that they have a unique biology. So you cannot, I understand why we have to diagnose sometimes because we need some kind of boundary for us practitioners. But when the nocebo effect, nobody talks about that, right? The second you get that diagnosis, guess what? You're like you just
That
said.
is now your new persona in a sense,
Yes,
right?
right. Yeah. And
Right.
that's
So
frustrating as practitioners because I'm like, no, like you're not depression. You might wrestle with it, but let's get to the root cause of it. Just with you. Okay, so let's go a little bit into, so you started your own company. What's the name of it?
oh, I just go by my name, Dr. Lauren DeCicco,
Okay.
doctor of physical therapy.
Okay.
And I focus on really
Cool.
performance, wellness, and like because a lot of people come to me not necessarily just for like skilled rehab services.
Hmm. Okay.
I do more like wellness services with people.
That's cool. So let's go into that a little bit because I saw a huge list of all the certifications you have. I'm like, this woman's ambitious. Like I thought I
I'm
had
a nerd.
ambition.
That's what I am.
Me too. I love it. Oh my goodness. If I just met a nerd like that gets the whole thing, I'm so happy. Like we're gonna have to just hang out after this. So you have like vagus nerve stimulation techniques, lymphatic system stimulate, dry needling, Graston technique. I've heard half of these or a little because I am holistic. I understand the nervous regulation of trauma. That's
Right,
something I've
right.
studied, complex PTSD and stuff like that. So I want to go through a little bit of like all your, not all of them, certificate, but what's important with let's start with the nervous system because people don't understand that whole fight, flight, freeze, or fawn. They don't understand, like, logically, I know that I should be doing A, B, C. Why is my body reacting? Because that's what I say. I'm like, your body's activating right now. We
Mm,
have to get to the root cause of it and rewire the brain. So I
right.
would love to know how you do that.
Okay, so so I have that whole list of things that I do, but
Yeah.
the foundational stuff, the stuff that I focus on with every single client I see, whether I'm seeing you for chronic illness, chronic pain, all the way up to high performing athletes or high performing professionals. I'm even working with people that are coming with like physical manifestation of their anxiety, depression, or trauma. So, the nervous system is like the number one foundation to being able to achieve positive outcomes for
Mm.
people. So I'm not going to go straight to your knee pain. I'm going to address your nervous system first. So then when I do address your knee pain, your body is able to handle the treatment and optimize that treatment to the best ability, right? Okay,
Okay.
so the approach that I take with the nervous system is, and it's the part of the nervous system, the autonomic nervous system. Like
Mhm.
you said, that's the portion of the nervous system that goes into sympathetic, fight or flight,
Mhm.
or parasympathetic, that rest and digest state. And I would say 100% of people that I see are sitting in some sort of excessive state of that fight or flight response.
Right.
The people that I've seen that are in those chronic states, chronic presentations, so chronic illness, autoimmune, pain, chronic histories of like complex PTSD, things like that, they've been revving for so long in their fight or flight response. A lot of them now are dipping down into that like freeze or fawn, immobilized response. So
Mhm.
they'll just fluctuate between excessive states of fight or flight or excessive states of freeze or fawn. So they either go excessively turned on, overstimulated, or shut down, right? And so basically, what I do is I start off by reintegrating safety for
Mm.
them because
Okay.
that's the number one. That's going to be the fastest way to break that cycle of all of those states. Fight, flight, freeze, or fawn are states of survival. Our body is very smart in a way
Yeah.
that it has learned that anytime it feels threatened, it's going to activate those survival responses. But what tends to happen is we get stuck in them. We don't have these like integrated internal resources to turn that back off and balance us back out. So because we've been stuck in these excessive states, um, someone like me, I'm going to come in as an external resource and I'm going to send a signal of safety to
Mhm.
your body.
Okay.
Okay, so I do that through stimulation of the vagus nerve.
Okay, let's go there for a second because a lot of my listeners might not even know what you're talking about. Like, what do you mean parasympathetic, sympathetic nerve? I mean, I get it because I studied it, you studied it,
Right.
but like,
Mhm.
it's like
It's
also the vagus nerve. Like, I
uh-huh.
get it, but how do you explain it to your patients?
Okay, so and this has taken me a long time to find the words and these explanations
Yeah, for
to tell
real.
people because it is so kind of really in depth and it's abstract and so this vagus nerve is a cranial nerve, meaning it comes directly from your brain
Mm-hmm.
and it travels through an opening in your skull near your ear,
Right.
both ears,
Okay.
and it travels down the front of your neck, behind your chest bone, and into your abdomen.
Mm.
And this vagus nerve is incredible because it really, when it's activated properly, it starts to balance out our nervous system because it's sending us a signal to the brain of safety, essentially.
Right.
It should naturally activate on its own. But for a lot of different reasons, our vagus nerves in our body are suppressed for whatever. It could have happened. All of us have different histories, right? So
Right.
it could have been like developmentally,
Mm-hmm.
as small babies. That's when it really starts to take shape and form. And that typically happens when we're nurtured and we're a, build healthy attachments with our caregiver, things like that. It starts and we are soothed as babies. That's our first form of regulation.
Mm-hmm.
Um, is coming from our caregiver typically, and that starts to tone and develop that nerve. So it helps to keep us really well balanced when we have stressors. Stressors are healthy and normal typically, but we
Right.
still have to have that balance, right? So the vagus nerve will kick in to balance us back out. It can happen from like if you have suffered from whiplash, if you've
Wow.
had a lot of upper neck, cervical tension, if you've just undergone tremendous amounts of stress without any sort of escape from that, right? So if
Mm,
like you're just chronically overloaded in a stress response, it starts to deteriorate the function of that nerve as well. Traumas and things like that.
right.
Um, all sorts of different things can affect that vagus nerve. So I go in and I do techniques to the vagus nerve to reactivate it.
Mm,
So I use vibration, I use stimulation. I actually have a device that I use that gives an electrical impulse to right over the path of the vagus nerve to
wow.
kick it back in
Hmm.
and teach it to flex back on to balance that nervous system back out.
Okay.
And once that nerve is kicking in, then it will send that signal of safety to the brain, and
Hmm.
then the body can pull back out of that over responding stress response
Right.
and help to balance back out.
Wow. Okay. I mean, that's great that you do that. How long would it I mean, I know it depends on how much stress that they're on because it is like it's like your brain's on fire. That's how I usually put it. Like all of a sudden your brain's on fire, but logically you need to do A, B, and C and D, right? Like some people they come to me because they feel a lot of guilt and shame. Like they
Mhm.
know I need to be doing this. They know I need to be all this stuff, but I have this and I don't, and people are telling me you should be over it or whatever it is. Like this happened when you were a kid
Mhm.
or whatever the situation is, right? Because there's a big T trauma, which happens, and then there's the little stack ups that I like to call them, right? The little, like something happened when you were little, and then this other thing, and this other thing, and this other thing, and there you go, on fire, and your system's going boop, boop, boop,
Right.
and you're trying to regulate them. Um, what's the typical start? Like, what would be the first thing? Like, I'm brand new to you, and I come into your office. What would you do with me? First thing, you never met me. I just hired you to help me out because I heard you did some really good stuff on the Holistic Counselor podcast. And now I want my therapist and you too. Because
Mhm.
honestly, it's a team sometimes that we need. I know I have my team to help me with my
Right.
situations, right?
Right.
So what would you do if I walked in your office and I'm like, help?
So the number one thing to understand, like what you said, is especially with the logical part of the brain is telling you, I need to be doing all these things. And then you start beating yourself up because you're not doing the things. Well, there's a reason why you're not doing the things, because subconsciously, from a nervous system standpoint,
Mm-hmm.
it's a protective response to
Mm.
kind of be stuck in those behaviors and those patterns because our nervous system would prefer a familiar hell over an unfamiliar heaven is what the
Wow.
saying is,
I
right? So
love
like no
that.
matter what, you can tell yourself all day long, I should be doing this. I know what's best for me. I know I should be over this because I'm not actually in that position that I was in when I was 7 years old. I'm actually safe and whatever right now, but your body doesn't know a different story,
Right.
right? So your body has a felt sensation in it that it experiences, and it sends that sensation up to your brainstem first. And your brainstem doesn't have a timeline, right? So it doesn't understand logically that you're not 7 right now, that you're 27. And
Mm-hmm.
then that story goes to your brain, and then you're like, wait a second. So then, and then you have to convince yourself, wait, no, like I am safe. And
Yeah.
then you have to tell your body, no, we are safe. So what I do is I start reintegrating that felt sensation of safety to the body so then it can then tell the brain that, yes, we are in fact safe right now.
Wow.
So my first steps when people come into my office, so day one would be, and I get an idea. People talk to me, they'll call me and kind of explain what they're experiencing. I'll go by kind of what their physical symptoms are, like, oh, I'm always have neck pain. Am I always
Right.
clenching my jaw? I just am always agitated. So I'm already listening, I'm like, okay, so they're more in a fight or flight, or if they're like, I feel like I can't get out of bed, I'm so tired, I get sick all of the time, they're more sitting in their like shutdown side, right?
Hmm.
Because they've been under too much load for too long. So I already get an idea, but when they come into my office, I first will kind of I use my own system, my own nervous system to
Mm.
co-regulate with them when they come in. And that gives me a good idea because I can actually feel with my nervous system what they're feeling and experiencing.
Wow.
So I'm co-regulating with them.
Hmm.
But then I'm also using that co-regulation to help them to regulate their system because my nervous system is always going to stay regulated when I am working with them. So I'm going to be the safe, calm, centered nervous system
Right.
in the room. And then when they get near me and in my space, they're already going to feel different because they are now going to be co-regulating to that. So our nervous systems will speak to each other in that way, right? Like you get near somebody and you can kind of feel
Their
what they're
energy.
feeling, right?
Yeah.
Their
Yeah.
energy, are they anxious? Are they now I just got near someone and now I'm anxious.
Hmm.
That's their nervous system in that state and it's creating that sensation within you as well. So they're kind of mirroring each other. So
Hmm.
I use that mirroring technique, that co-regulation, to really feel what they're kind of experiencing. But the key to that is that I maintain my regulation. I don't let their dysregulation
So how do you
change.
do that?
Oh, I have to practice. I make sure
Yeah.
I use all my own techniques and
Okay.
get myself in a very regulated, centered state
Yeah.
to prepare for what I'm
What's to
taking
come? No, seriously, that's the
on,
same
right?
for me. I have a system before I see a client. Once once I do a free 15-minute consultation, right? Because right then I'm gonna know if I'm the therapist for them. Because
Right.
we're not everybody's cup of tea, no matter
Right,
what,
right. And you
right?
can tell, and that's that again, it goes down to that co-regulation, right? Like are your nervous systems going to be like this,
Yeah,
butting heads and
yeah.
like almost like causing a resistance to each other?
Mm-hmm.
Or are they kind of really acclimating and
Right.
magnifying towards each other? And so yeah, really it's about me keeping that holding that space for them. And then my space itself, I try to keep it very safe feeling, very open, meaning they can tell me anything. Lots of listening and validation. So that's like people being heard is like one of the
Yes.
first steps to that transitioning into healing, right?
Yep.
So
Yep.
connection, trust,
Mhm.
being heard and validated,
Yes.
that's all what's going to get established in that first session.
Right.
And then I'm going to start doing some stimulation to those different portions of their vagus nerve and their nervous system to help to regulate them in that moment,
Hmm.
in that session.
Okay.
So within that session, they will become centered and regulated
How long
before.
does the session last with you?
Usually an assessment, like the first session is an assessment and a
Mhm.
treatment, and it's about an hour and a half. That
Yeah,
is,
okay. That's cool. I do that too. My first one that you to see me, you have to be 90 minutes. And then yeah, and then from there on it's usually an hour from there on.
Mhm.
But okay, so
Yeah,
tell me about because I know you said you do quite a few different techniques depending on the client. I bet you anything you're like, okay, this person needs A, B, and C,
right.
right? And that person needs D, E, and F. And so tell me all the things you do use to in your practice, like give me an without saying a case study or whatever, so because you don't want to put it all out there, but like you've been doing this for a while now, right? A couple of years in your own private way, like,
Yeah,
right?
so more in this like holistic approach and nervous
Yeah.
system, lymphatic,
Yeah.
more systemic approach has been
Mhm.
probably the last 4 years.
Okay.
Still compiling and adding on certifications and things
Oh
like
my God.
that. Right.
Wow, yeah, I hear you.
Well, part of that is it's part of your own healing journey too, right?
Yes, so what do you mean by that?
Well, I mean, I have my own history. I have my own history. I actually have complex PTSD from childhood and
Mm,
adulthood, and
mm,
um, I've had experienced some pretty traumatizing parenting experiences as well. And through that, I really, really had to take that deep dive in
yes.
how to address that trauma. And especially when it starts happening with your children and you're in the parent role,
Mhm.
keeping that nervous system regulated and not getting triggered, and then like seeing what the trickle down health effects were of all of that.
Right.
Right. So at one point, maybe 5 or 6 years ago, I was suffering from every autoimmune symptom, gut issues, and chronic pain, going to rheumatology, neurology, pain management, things like that. And when I kind of shifted my environment and left the environment that was actually making me sick and keeping
Wow.
me in that survival state,
Hmm.
a lot of that just got better.
Melted away.
And so I really realized like what that was doing to my whole system, what that like trauma was doing to my system. And so going down every rabbit hole of how to
Hmm.
address that, and then pulling from that how that was going to affect my clients who are coming in with chronic pain that's not getting better, chronic autoimmune that's not getting better, things like that, and really applying those tools to my clients,
Mm.
seeing such a dramatic difference.
Right.
With that, when you have complex PTSD, every day you don't know what could be a trigger
No.
sometimes,
No.
right? So I'm
Right.
still experiencing my own dysregulation here and there. I just know I'm super self-aware of what the shifts are and fine tune, and I'm really back in my body.
Mhm.
So I can actually attach to what it feels like to be super centered and regulated versus what the shifts are of becoming
Right.
dysregulated, and then what tools I need to use for myself.
Yeah. So what tools worked for you? Because I know what worked for me. Because I mean, I don't know if you want to tell the listeners what your ACE score is, your adverse child. I mean, 'cause I don't know if you even took the 10 question test
No
or
one's
not.
ever given me the test. I know
Ah,
about the
okay.
test. Like we talked about the
Yes.
test. No one's actually ever
Yeah.
given me the test.
Really? Okay, but we're not going to give it to you right now because we're talking. But I'm just thinking if you had CPTSD, usually what I've come to understand and research is like anything over a 4, that's what correlates with autoimmune. This is
Yeah.
something that they're, and so the higher the, but doesn't mean you're doomed. So, listener, if you take that ACE score, which I'll leave it in the show notes, and you're high, it does not mean you're doomed because some people get freaked out over that. They're like, oh my gosh, my score was a 9. And 10's the highest. And then now they're thinking, I got all this illness. Like you said, you're stuck in some, but we're trying to tell you as holistic practitioners that the obstacle is the way to healing. You got to go through it. You can't ignore it. That's where self-medication comes into play, right?
Right.
And stuff like that. So for you, because you realize like I need a shift and change, or I'm going to be stuck and I'm going to now continue on this intergenerational thing that like people are
Right.
talking about now.
Really
But
about breaking the cycle, right?
yes, breaking the cycle. So, what was your like aha moment? Like, was there a book, a podcast, a TV show, another human that like a doctor or somebody else that you all of a sudden went, whoa, that makes sense. I need to go into that rabbit hole.
Discovering the nervous system.
Yeah.
Oh my gosh. I think it was probably a YouTube video. So I went through a pretty traumatic breakup.
Mm.
And that's when I started looking and exploring, like, okay, I got to this place for a reason of how I
Mhm.
ended up in this situation with this person. And again, and it kind of basically repeated a cycle from childhood,
Mm.
of trauma and things like that. So I knew like what I need to do something so that this doesn't keep repeating itself,
Right.
right? So I started doing a lot of more of like the mental health side of it.
Cool.
So a lot of like top down processing, understanding patterns and things like that. But it still I felt it in my body, right?
Mm-hmm.
And the triggers and the visceral responses and the activation to things. And something came across, I don't know if somebody sent it to me or what, about this woman on YouTube doing a vagus nerve exercise. And then I was like, well, what is this vagus nerve thing? And why is that something that's going to help with my stress and my trauma and my chronic pain?
Right.
Then it just sent me down this rabbit hole of like your vagus nerve and your nervous system is in charge of your tissue tension, your digestive system, your inflammatory response. It literally puts you on pro-inflammatory or anti-inflammatory, your
Mm,
immune system. Um, and then even how you present in the world, your motivation, your ability to engage with others and socialize and all of this stuff. And it just, I was like, okay, so how do I do this? What do I do? So I looked up every single course I could find. I signed up for this woman that I found on her YouTube, her nervous system program,
hmm.
healing your nervous system. I've worked with this man who's a chiropractor, and that's where I learned the physical manipulation of
Okay.
the body, where you can access those different points of the sympathetic, parasympathetic nervous system and the vagus nerve to shift from a physical standpoint
Mm.
into there. I'm getting certified in somatics right now so that
Wow.
we can help to discharge that wired response of stress and trauma from the body and what's
Hmm.
being stored in the body. So I'm going to finish that hopefully soon because I feel like that's a huge component to help people safely discharge those trauma responses from their bodies without having to relive the trauma
Right.
necessarily and
Yeah.
reprocess and relive the trauma. So it's a way to help heal that from your body. And that for me is also like that's a certification I'm doing right now that I feel like is going to be part of my continued healing process as
Mm.
well.
Yeah.
So,
Okay. That's wonderful. I love that. Were there any books that you read? Like I know for me as a therapist, they have the polyvagal theory.
mhm.
And so I studied that some, and that's where I was like, oh, okay, that makes sense. Body keeps the score with Dr. Bessel van de Kolk. That's
Yeah.
like everybody's go-to. Like, yeah,
Mhm.
that made
Waking
sense
the
too.
Peter Levine, Waking the Tiger.
Mm,
The body, you like pretty much those are the big ones. I think there's a lot of professionals that I follow that their theory is what I really like the information that they're putting out there about the nervous system. So a big guy, the one that I took coursework from is Perry Nicholson,
hmm.
Stop Chasing Pain.
Oh, I love that.
And that's
Okay.
his website. He's amazing. And he teaches a lot of the things that you can actually manipulate in your body so that you have a tool to go to. So I think one thing that's really hard for people that are dealing with triggers or stress responses and things like that is our reflexive part of our brain is
Mhm.
starting to respond. And then we have to remember all those tools like, okay, just breathe
Right.
down, whatever, but you don't really have access to that,
No,
right? So when you're in
not
that
when you're
stress
in it.
response, so what I've taught people is get something that vibrates. So I have everybody get a ball that vibrates and they take that ball and they just all they have to do is get that vibration on them.
I love that.
And that vibrations it feels soothing. So it's all about self-soothing, really.
Mm-hmm. Yeah.
But it's hard to cognitively be like, okay, I need to
Right.
calm down. I need to breathe. I need to slow down. I need
Right.
to remind myself, like, I'm
Right.
in this moment, I'm present, whatever. So that is one of the most effective tools that I found for people is to just take that vibration. And even my kids, they're young, they're 7 and 10,
Oh, wow.
but they take the ball, they sit with the ball, and
I
they
love
just
that.
start to self-soothe with that as well.
That's a beautiful tool because that's my next question. Like, is there any, because not everybody could afford therapy, right? And not everybody could
Right.
afford going into non-insurance practitioners. And I get it. I get people telling me like, why, and that's why I try to keep my prices reasonable because we still are people that have to, it's like a balancing because we know what worked for us and how hard we had to work. But how I say it's like you're going to pay either way. You're going to either pay for prevention and root cause, or you're going to pay for intervention and staying stuck in the system. You're good.
Well, and that's saying, I think too, people detach from the fact that their insurance is paying for something, but you're paying for your insurance. You're paying quite a bit for your insurance. And then
Exactly.
your insurance is telling you where you get to go.
Mhm.
So it's you're not
Right.
even you're giving your money to these people and you don't even get a choice in anything. So it's also taking away some of that self-agency and autonomy with people too.
Mm,
So I
hmm.
think that's why when people make that commitment financially
Yeah.
they are deciding this is who I want to go to and this is who I want to see.
Right, right,
And it reinstates that self-agency there too. So yeah, I think it's important that we are still accessible to people, right?
right. Yeah.
So and it might not be like in a one-on-one session or something like that. That's why I try to put out information on
Yeah, this is why I did this
social
podcast.
media, the
Yes,
podcast,
that's
right?
why I
Yeah.
mean, you're not getting paid. You're not a paid speaker on the podcast. You came on because you realized, like, okay, how do we get information to the masses so people will have that self-agency and take control? Some people don't think they have control because you're the one with the doctor degree and I'm the one with the, masters or the certifications, but it's understanding like you are this individual human being with your own thumbprint, with your own journey, and now you get to choose what you
Mhm.
want to do. What do you want to do? Do you want to stay stuck and just, you know, balancing or symptoms? Basically, that's what you do, right? I know I have autoimmune. I've been diagnosed with autoimmune and
Right.
I've been working through it with my integrative functional doctor, but that's why I'm like, I was so curious about what you have to offer because I'm like, maybe I'll go to her too. And because I check out everything. Like, honestly, I go to acupuncture, I go to chiropractic care. I have to, especially with the work we do. If you're
Yeah.
sitting there picking up people's energy, I am
Right.
too.
Right. You had to be, as the practitioner,
Mm-hmm.
so careful about holding space, that you're really just holding space, that you're not actually merging with the person,
I love
right?
that. I love that.
So
Let's talk
my
about that a little more.
the therapist I work with says always resist the urge to merge, right?
I love that. Oh my goodness, that's
And
that right
I
there.
live by that. So it's
Yes,
so easy to do,
resist.
especially as a parent
Yeah.
and,
Mm-hmm.
someone working with people.
Because
Yeah.
that's the Instagram reel that I saw. You were sitting there training practitioners, and you're like, if you're a clinician, a doctor, and you named it all, and it was just a short, I don't know, 15-second reel. And I said right there, I'm like, and then the nervous system, and you need to, and I'm going, I need more of that. I wasn't able to go because I had something else, but then I'm like, I need to find out who this woman is. And then I started following you and saying, okay, let me see if I really, really like what she's saying. And I'm like, oh my goodness, this woman gets the science of things because to me, I like to explain it clinically as well because we're clinical, but you get the holistic part of it as well too, like understanding like we're a whole being. It's not just that one part. It's like understanding all your parts coming together,
Right.
right?
Right.
So let's talk about just like this different like what is dry needling?
Dry needling. Okay, so everything on there is like, so they're all different certifications and modalities, and dry needling is using acupuncture needles
Mm-hmm.
to go into soft tissue structures and help to release the tension from those soft tissue structures. So it's targeted more towards musculoskeletal. So the muscles that insert around joints. Say you have neck pain, I'm going to target that tight muscle everybody gets on the top of their neck going into their shoulder, and it goes and it just immediately realigns and releases the muscle fibers there.
Mm.
It's not for everyone, but it is super effective for treating soft tissue and musculoskeletal chronic issues. People come in with acute pain and it clears it up very rapidly. Muscles that just won't release, and we sit there and we dig and we dig and we dig. When you go dry needle them, it pretty much helps that muscle release immediately. But then it
Wow.
helps in the systemic side to it is like we start building this pain response. So our shoulder hurts, it tells the brain I hurt. The brain says, okay, I'm going to protect that shoulder. I'm going to tighten all the muscles around there. I'm going to change your movement patterns. And then it hurts again, it tells the brain. So it's like this vicious cycle that goes back and forth. When you
Mm-hmm.
do dry needling, that insertion of the needle
Mm-hmm.
helps to like trigger a response to turn that pain cycle off.
Wow.
So it's pretty effective when I'm dealing with people that have, anything from acute to a chronic issue. And it helps send new, fresh cells to that area. So like stem cells and lay down new collagen fibers and things like that. So it's got a lot of benefit to it.
Yeah.
But again, it's really not for everyone. When people are coming in and they've been in like a really heightened fight or flight response,
Mm-hmm.
and then you start sticking needles in.
Yeah. They're like,
You know?
yeah.
So it's amazing for the people that can tolerate it and don't have any sort of like needle aversion. But if people
Hmm.
are creeped out by needles at
Yeah.
all, it's
Right.
not going to be effective for them because it's going to put them more into that
Okay.
survival response. But
Okay. No.
it's really a soft tissue modality that I use that for people that have musculoskeletal complaints.
Do you use meridian, like the meridians from traditional Chinese medicine to put it in
No,
there, or
so
is it different?
it's different from
Okay.
acupuncture, and that's the
Okay.
big thing. And that's why it's called dry needling. And
Okay.
I'm a physical therapist doing dry needling.
Hmm.
It's just a technique.
Okay.
Acupuncturists, are going to school for a very long time to learn that
Yes.
whole theory of practice,
Right.
right?
Right.
Treating and diagnosing and things like that, and using those acupoints to achieve the outcome that they're looking for.
Okay.
So that's the difference between acupuncture and dry needling.
So, out of all of these, because I'm going to name them all, well, most of them, like vagus nerve stimulation, non-dietary gut healing techniques, lymphatic and lymphatic brain system stimulation, the dry needling, the Graston technique, functional range conditioning, blood flow restriction, and I mean, it keeps going and going with TMJ dysfunction. Out of all of these that you do, what would be the one for mental health? You know what I mean? Like you just said that that's muscular, like someone comes into pain, and if they don't have CPTSD or a score that's high. And so what would you do with someone that's coming in with anxiety or depression?
So when people come in with some sort of mental health diagnosis,
Mhm.
I'm not going to treat that mental side of it, right? But I am going to explore what are your physical symptoms that you're storing in your body in response to that anxiety and depression, but are also feeding that anxiety and depression, right? So
Mhm.
those we only know we're anxious because our body is sending a message to the brain. It's a felt experience and sensation in our body. It could be increased tissue tension, it could be stomach pain, it could be a knot in our chest, tightness, shortness of breath, things like that. And then that sensation tells the brain I'm anxious, right? So I'm going into the body
Mhm.
and exploring what those different physical symptoms are. And I could address it. I mean, some people do come with some multiple region chronic pain that's a result of being in that chronic cycle of anxiety and
Mhm.
depression. So if we can break some of those signals that are
Mhm.
going up to the brain and reestablish some of those signals, then we're going to help with what's going on with that anxiety and depression. So it's
Right.
a two-way street, right?
Yeah.
So and like the top, we got top down, what the brain is telling the body, and then we have the bottom up, which is what the body is telling the brain. So
Mm.
I'm going to approach all of those physical messages that are going up to the brain. So it could be vagus nerve stimulation so that we can reactivate that balance back into the nervous system. A lot of it could be soft tissue work as well. I'm always going to do lymphatic work.
Explain that, please. Just a little. I know what the lymphatic system, but for the listener, like, what do you mean by that? What I have another system. First, it was the skeletal, and then
Yeah,
it's the central
and
nervous.
the lymphatic system is almost just as important because this system are a bunch of vessels and nodes that follow your entire region of your body from your brain all the way to your
Oh,
toes. And
hello, Dr.
can
DeCicco. Oh, hello.
you hear me?
Now I can. Oops, sorry. There was just a. She froze. She's back though. Yay! All
Okay.
right.
I don't know where it froze at,
So
but
it was the lymphatic system, the nodes. I think that's the
okay,
last
yeah. So
word.
it's all vessels and nodes that
Yeah.
basically follow all of your arteries and veins and nerves that go from head to toe, and
Mhm.
it cleans and clears out all of your cells. So as cells break down, as they process different things, it clears out toxins, infections, and it keeps your fluids. So think of like a fish tank, right? So when that fish tank gets all backed up and disgusting, like the pipes and everything are what goes in and filters and cleans all of that back out, right?
Yeah.
Sometimes the system gets backed up. And it's typically related to lack of movement, high amounts of stress, um, poor diet, not move, like being in that activated nervous system. So when our nervous system gets highly activated, our tissue tension increases, and that cuts off a lot of our fluid dynamics. When you cut off fluid dynamics, then you're going to get backed up and stagnant in your lymphatic system.
Yeah.
So your body's not detoxing and cleaning itself out the way it's supposed to.
Yeah.
So I go in with different stimulation techniques, and I stimulate the major choke points of the lymphatic system to help encourage that fluid to move and flush and detox the way it's supposed to.
Okay.
So again, if you leave that lymphatic system and you don't address that when people come in, then that is going to continue to also send a message of threat back up to the brain saying like, I don't feel so good because I'm really backed up with
Mm-hmm.
toxins and waste. And now I have like issues where I'm swollen.
Yeah.
My cells aren't healing. They're not regenerating.
Right.
And those are all threat responses or threat messages that are going to your brain. So it's going to keep adding to that cycle. All
Mm-hmm.
right. So same thing with like a lot of functional medicine, people will gut health, for example, has a huge effect on your mental health because of
Right.
that gut brain axis. So you have to address everything in your body in order for your brain to feel good as well.
Yeah. No, you're right on. Like the lymphatic, like I learned about that. My sister had cancer back in the day, and when they took out her nodes under her breasts and everything like that, her arm would swell up. And then you're
Yeah.
feeling crappy, of course, and then you feel depressed, and then you get stuck in that cycle and stuff. And she would have to go every once in a while to get that lymphatic massage
Yeah.
to move it to the other side. And that, this is why I became a holistic counselor, because there was so much stuff that happened in my family and my past, right? So I research, we're talking about how we're nerds, but that's who I am. I'll go into these rabbit holes because I want to learn how to not only help my clients, but myself. I don't
Mhm.
want to end up at, 75, 80 years old. And even if you are 75 or 80 with 10 orange bottles next to your bedside, there's still hope. You still can
Yeah.
change your brain. You still can do something about it. You are not stuck. That's what I keep trying to tell people. If sometimes it feels like you're in a cage, but that cage door is open and you're able to fly if you find, have understanding and become your own advocate. So to me, like, do you dry brush?
I will use all sorts of lymphatic techniques,
Me
only
too.
because our body acclimates rapidly to the same stimulus all the time.
Mm,
So if I use the same lymphatic routine where I'm like rubbing and
mhm.
I do that same thing every single day, my body is going to start to get used to that and
Right.
it's going to plateau. So
Okay.
I'll vary use um do variations between like manual stimulation, I'll change the depth, I'll change the speed. I'll use vibration, I'll jump on a rebound or trampoline, do hitting techniques,
I
dry
do that.
brushing. It's just all about giving what we call a novel or a new stimulus to the body.
Okay.
And
Yeah.
that also helps to really reconnect and pull you into your body as well. So that's another nice effect of doing some of this body work stuff to
Hmm.
yourself is really pulling you back into your body and having that full experience back into your body. Because a lot of us are like really
This is
detached from our
disassociated.
physical sensation,
Yes.
right?
Yes.
So,
Yeah.
and
And
these are like very pleasant sensations. So it's
mhm.
it's not about just getting back into your body, but it's like really reestablishing and rewiring pleasant sensory information there
Mhm.
too. Because
Right.
that's what's going to start to, the more you can hardwire those experiences in the body,
Mm.
this the less you wire those like chronic pain or unpleasant
Right.
sensations in your
Yeah.
body.
And also understanding when those chronic, to me, it's like, okay, as women, especially, we have to understand our cycle too. And many women are so detached from that. They don't know when their winter, spring, summer, fall week is in their month. I'm in menopause, so it's just like what I'm on my second puberty. That's what I call it. But right, it's like really getting to know you. It's okay to get to know you because a lot of people that I work with the BIPOC community, the Black Indigenous people of color, and the the things that we go through is very different than some others that that might have been born in this country and stuff. So it's teaching them it's okay to take care of their cells,
Mhm.
right? So then they can function in a healthy way for the family.
Mhm.
or, and being able to say no, because
Right.
we're trained, like a lot of us, and it's the culture, our culture, it's very individualistic. It's very like, oh my, comparison, especially the younger generation that I work with. It's just like they have I had Cosmo or whatever to compare, and I really didn't care back then. But a lot of us that are, we're looking at social media, how many likes, just sitting in front of a computer. I mean, I'm an online therapist for the state of Florida, and I'm here. So I have to do my work, right? So I will go outside after I'm done with you because I have another client coming, and I'll go outside, sit there in the sun, do some prayer, breath, barefooted. These are the things I learned. Nobody teaches this in schools, or how to, take care of your gut, like gut health, like microbiome. What are you freaking talking about? Second brain, like,
Yeah.
right?
Yeah, and I think, well, we're teaching children very young to
Mm,
really detach
yeah.
from their innate
Mm,
desires to be in their bodies and move and express and things like that, because we just want them to sit still and be rigid. And like one thing about understanding what you're feeling and your emotions is what it feels like in your body, and we don't even know what our body feels like, right? So really developing and one thing to like reestablish getting into your body is through movement.
mm,
Really, if you're not moving very much, it's really hard to attach to what feelings and sensations you have there, but developing language around it too, like just descriptions. And it's not just about like, oh, I feel anxious.
mhm,
Well, what is that feeling? Right?
mm,
Is it pressure? Is
right.
it tightness? Is it like give it a size? Where is it? Like actual descriptions of what that is and where it's at in your body too.
Yeah.
And like teaching, I mean, but the kids learn to detach from that super young, and then we just
Right.
grow up and we have, we're 30 years old and we have no idea why I feel the way I feel, and it
Right.
feels terrible and out of control.
Hmm.
And then I don't know what it is. So now I'm anxious. There's just so much that goes with that. But
Right.
really, it's about getting people back in their bodies, but safely,
Right.
right?
Yeah.
So, and then teaching them like, okay, like, where is that? What is that? How do you
Mm.
describe that? And then being able to do something with that. So that's where you're like going to re-empower people, is getting them back into their bodies safely, and then having that control over like the awareness of it, and having the tools to then, it's about making you the driver of the bus again, right?
Yeah.
We're not getting dragged behind the bus. We're the
No.
drivers of the bus. Like our
Right.
systems are going to respond the way they respond, but it's about being aware and then like reintegrating that safety
Yeah.
and self-control and things like that.
Right. And resiliency too, because we
Resilient.
also are living. I mean, I worked with adolescents for a long time, and I love that we're talking about mental health. And sometimes, though, it's like, I'm anxious, I'm depressed, I'm anxious. And then they get into, I'm suffering from depression. I'm like, no, like clinical depression, to be diagnosed with that, has to go through a whole bunch of stuff. I will validate them. I'm like, yeah. But sometimes we have to understand not to be scared of being sad or stressed, because we need a little bit of that to understand happiness. And so it's the balancing and disentangling of certain things, because it's like so many, it's a lot of work. We both have a lot of work to do with people,
Right.
and especially holistically. Like, that's the thing. It's like, okay, is it resiliency that we have to do, because they're kind of in fear mode all the time? How do we get them to get back to their body? I use a lot of like, for me, I have an acupressure mat. I know that sometimes I need to go lay on that thing because
Mhm.
I need to get back to my body. Right. And that sensation, like at first, my husband did it and he's like, what? This is weird. And then after a while, we're like doing breath work on it and,
Mhm.
Wim Hofing and stuff. It's really learning to regulate. Or I do the 528 megahertz little dingy that I got on Amazon, and that right there, I'll hit it
Right.
while I'm praying in the morning, watching the sunrise.
Right. Because sound is a
It's,
great way to really allow you to safely be in your body again. It's
yes.
about safely being in your body. And I think some of it is that we almost like reject ourselves when we
Mm,
don't have unpleasant sensations in our body.
Exactly.
We're like, why
Exactly.
do I feel this way? I don't like it. I don't want that. And
Right.
we push it away and we stuff it down and we say,
Hmm.
just stop, but if you really just kind of sat in that and said, what is it that you're trying to tell me right now?
Yes.
And like love that part and nourish and support that part. Like, what is it that you're asking for right now? What is it that you're trying to tell me right now? What can I do for you right now? Because that's what you would do for your friend, right?
Hmm.
That's
Right.
what you would do for a small child walked over to you and said, like, they don't feel good and they are this and that. Like, you wouldn't say, like, ew, stop, go away.
Right.
How we do
Hopefully not.
are like, ideally,
Hopefully not.
I
Because
mean,
there's you
it
never know
happens.
nowadays. Yeah.
We know that this happens, but you as yourself would that's
Right.
not how you would talk to somebody else, right?
Right.
So really having some acceptance for yourself that you're not maybe in a pleasant state, but like really self-love for that. And the more you can sit in that like self-love side of those unpleasant sensations, actually the faster it is that you move through them
Yeah.
because
Really.
you're acknowledging them and you're nourishing them and like
Yes.
and healing them that way, right? So I'm teaching my clients how to not have like rejection, shame, or guilt for what it is that they're experiencing, that these are your sensations are your compass, right?
Yeah.
Your built internal guidance to what it is that your body and your system is asking for. And then using that to really like realize where they're at in their system and
Hmm.
acknowledging like, okay, I'm not necessarily like it's okay to go into that stress response, but not excessively, right?
Exactly.
It has to match what the situation is calling for, what
Right.
the environment or the situation is calling for, right? And if we're realizing like, okay, the situation is here, but my stress response is here, using one of those tools to the system to self-regulate you back down to what's appropriate
Mm.
so that we can be as clear and connected and centered in that state that we need to be in as possible, right?
Yeah.
But we have
Yeah.
to learn how to be in tune with our bodies again.
Yes. And it's a
Be-
scary process, right? I don't know if that, for me, when I first had to go into these places like that, I rather ignore it.
Terrifying.
Right? It is. And your adrenal glands are shot and all this stuff. And then you're like, oh no, I got to go into these different places. And I'm glad that I went to, I did a EMDR. I also went to a nutrition. I mean, it was like, I was going to pay either way. And I rather have done the hard work to go through it all and learn these tools. And that's now the beauty is, as wounded healers, like the two of us, we now get to teach others and, like, we're supposed I really feel like once we work through our stuff, and it's not that we're perfect or ever going to be, because we live in a world that there is toxicity constantly. If it's not other human energy, it's the food sometimes, or like the water quality or the air. It's just like we can't think so broadly that way, because that will cause you to like spin out and be like give up, right?
That's
But it's
stressful too. That's
right.
doing all the right things and
Yes.
biohacking.
Yes.
And I mean, you could go all day doing
Yes.
routines and
And then that could become
all of that
addicting.
stuff too.
Yeah.
And that's very stressful in itself. And
Right.
like, oh my gosh, I ate this today. And I didn't eat clean. Like it's like we're beating ourselves up even on like the healthy side of it too.
Yes.
So
Right
it's
on.
really just about being as kind as possible to yourself.
I love that.
And then so as far as like creating resilience for people, that's like on the tail end of my kind of like my protocol that I work with people. So first is like I help them reintegrate safety into their system, right? Because they
Mhm.
don't have those internal resources. Then I help them to basically develop their internal resources by continuously self-regulating with the tools that I show them. And then we start trying to increase their capacity to stress. And that's
Mm,
where resilience comes in, right? It's your capacity to stress. And um, we do that by pendulating or titrating, like adding a little bit of stress,
I love that.
seeing the person respond appropriately to that,
Yeah.
taking the stressor back out,
Right.
right?
Yep.
Adding a little bit more stress. And that can come in forms of like increasing the intensity of their workouts or their exercise,
Hmm.
starting to do some breath work that's meant to induce stress.
Mm-hmm.
So it's all about inducing a little bit of a stressor, but
Right.
in a really controlled way and allowing the nervous system to flex on and off appropriately to that. And now
Right.
if I see that they can't flex on and off appropriately, too much stressor, we take that away, right? So it's a game that we play of like how much can they handle and stuff like that. But that's where
Yeah.
you start to reintegrate that
Right.
resilience for people.
Yeah, exactly. It's not, yeah, I love that. Well, I could talk to you all day about all sorts of different things. So we're going to wind down the episode. I would just like to ask you if there was one or two things that you feel like that resonated in our conversation or that you think the listeners should really know, what would it be?
I think that the number one thing that is so important is really acknowledging where you're at. And if you feel like you've had enough suffering in your life and you don't want to feel that way anymore, you feel really stuck, there are so many tools out there for you and resources out there for you, and really exploring what you can start to learn through your nervous system and reintegrating safety, trust, and connection is really going to be probably one of the fastest ways you can transition from that um, survival to that thriving
Hmm.
state.
Yeah, for sure. Where can a listener find you?
So I like Instagram.
Okay.
I'm on Instagram at Dr. DeCicco, DPT. I have a website. It's optimize-movement.com. And I also have, if people are interested in learning a little bit more, like a beginner's guide to healing through your nervous system, I have a workbook, a
Mm-hmm.
digital workbook on my website. If you go to optimize-movement.com/heal yourself,
Mm-hmm.
you can download a free workbook so you can kind of understand the different components of the nervous system a little bit more. It's got basic techniques that you can start applying that you don't doesn't require any sort of like device or tools or anything like that. And it even has a daily log on there so you can start to track your nervous system day to day as well.
Wow. I absolutely, everything will be in the show notes, everybody listening. That's wonderful. Thank you so much for being here. I really appreciate you taking time to be with us.
Yes,
You
thank you. I
know,
appreciate it. I
yeah,
appreciate any opportunity to share
yeah,
and really hope that it helps people. So,
yeah. All right. All right, listener. So remember, trust in the Lord, guard your heart, and renew your mind. Bye. And now for the disclaimer to make sure you understand that you are responsible for you. The content provided on the Holistic Counselor podcast is for entertainment and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified mental health provider with any questions you may have regarding a medical or mental condition. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast. The views expressed on this podcast are my personal opinions and do not represent the views of any professional organizations with which I am affiliated. Call your doctor, 911, or 988 immediately if you have a medical emergency. The Holistic Counselor podcast does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the podcast. Reliance on any information provided by the Holistic Counselor podcast, guests appearing on the podcast at the invitation of the Holistic Counselor podcast, or other listeners to the podcast is solely at your own risk. Confidentiality notice. If you engage with the Holistic Counselor podcast by commenting or posting and are a client, please be aware that you may be revealing information that could compromise your confidentiality. Please remember that disclosing your identity or personal details can be linked to your clinical material. As a therapist, I am bound by confidentiality and will not respond to any disclosures of this type on this podcast. I am committed to upholding the ethics and confidentiality of the therapeutic relationship, which extends to all forms of communication in accordance with the laws and professional guidelines that govern mental health professionals. I want you to know that your privacy is of utmost importance, and you are responsible for protecting it when interacting on this platform or any other public forum. Thank you.